Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. My name is Dr. Wafaa Faisal. I am a consultant pediatrician in Dubai, and my guest for this podcast is Dr. Wajdi Albonji. Dr. Wajdi is an internal medicine specialist and a functional medicine and regenerative medicine. Dr. Wajdi Albonji, welcome to Medcast. It's a big pleasure to have you with us today.
Thank you for inviting me and to give more education and to give the people the hope that's going to change people's life.
Yes, we're going to change the life of people in this episode. I don't think we have all the time to speak about everything, but we promise them with more episodes and Medcast with you, Dr. Wajdi, especially because we're going to talk with you about longevity medicine, anti-aging medicine, which is now, I think, the most sought after topic, and everyone wants to really have more insights and more awareness, and they need to know how to start their journey towards a better, a longer, healthier life. So the first question I will ask you, how is functional medicine different from conventional medicine, especially when it comes to longevity and anti-aging?
Yes, functional medicine is the root cause analysis medicine. So always ask why. There's nothing say you have, for example, hypertension. Why I have hypertension? It's not like, only genetics. Okay, genetic, measure it. This is deficiency of something. Okay, measure it. So this is functional medicine. We want to understand why and to open the pathway. Whatever is the name of the disease, I want to understand what's behind this disease. So it's treating the disturbance and not treating the disease. And we try to fix the disturbance in a natural way if possible.
Yes, it is the root cause, probably more on a more cause level than just symptoms or cover it up or anything. Yes, and there is a role in prevention as well.
No,
when it
no,
comes to
functional
medicine.
Functional medicine is different specialty. Especially today, there is a functional medicine. Before was the naturopath. Today, it's a different specialty. There is a functional gastroenterology. There is a functional neurology. There is a functional psychiatry. There is functional women health, and there is a longevity. So it's a specialty. It's a new version of medicine, and this is different specialty. And the longevity is not only prevention. It's optimization.
Optimization. I
It
like
is
this word.
like,
Yes.
yeah. So
Longevity is at the core of functional medicine nowadays.
always say
Yes.
disease come from something called dis-ease.
Yes.
So if you are not living your life easy, happy, energetic, organized, meaning of life, this is not longevity.
Exactly. Exactly.
So-
Great. So starting from aging is a disease that can be probably slowed down or even prevented. Starting with the big information that we have reached nowadays that aging is a disease. What are the main pillars of anti-aging medicine or longevity medicine when it comes to lifestyle and how the people are living their life?
Yes, to answer this question, we want to see why we age. The aging is a physiological process based on many changes in our body. First, oxidative stress, hormonal disturbance, including cortisol as a stress hormone, and insulin resistance, sex hormone drop, all of this. Plus, inflammation, chronic inflammation. Now we say it inflammaging. Is low-grade inflammation that like put yourself, put anybody on fire and like losing-
Slowly.
it go you in something called catabolic state. You are not building the body, you are destroying the body. So we call between anabolic state and catabolic state. So this is very important to see the inflammation. And the most important, the nutritional deficiency, the chronic nutritional deficiency. Any deficiency, let's say selenium, zinc, whatever is
We call it hidden hunger.
complex.
The hidden hunger.
Right. Our body need need a lot of raw materials to build. So every day there is a destruction of cells and regeneration of cells. So we need raw material. And the regeneration is based on stem cell. There is something called stem cell exhaustion, is fatigue of stem cell. And something called zombie cells. Zombie cells, if cells programmed to die and they didn't die.
The
And this-
energetics health.
yeah, and this cells is senescence. We call senescence. It's not function, but consuming energy
It produces toxins.
and producing inflammatory
Yes.
cytokines. So this is this process and at all in general, uh,
Aging.
aging.
Yes.
And it started why this disturbance happened in three main pathway: emotional stress, and this is a cortisol; gut inflammation, and
Microbiota and
exactly.
microbiome.
And the third is detoxification. You are not cleaning the body. So detoxification and accumulation of toxins from heavy metals, from biotoxin, from everything around us, is this accumulation increase the aging process. So when we put all together and we measure all of this and we start make a strategy, so to layer what's the main dominant factor in your body. Longevity is not only giving some drip or stem cell or
Or a
take some supplements.
tablet.
No, it's holistic and precision at the same time, and this is the art of longevity.
And you know, when you know the causes and you start to live your life with awareness, you start to be aware about anything you put in your mouth, anytime you are sitting lazy, not doing anything, or anytime you are stressed, even. So it gives the person an awareness about a better, even day to day life. It's important, of course, for the long term, but also the moment we are in right now is also very important. So, brilliant explanation for everything. But we need to start somewhere. So, because human beings, as we were mentioning with a life coach in the previous podcast, that human beings need to be coachable. We need to be coachable. We need to be feeling that we are accountable to someone. So, how do we tell the people the main pillars of longevity are sleep, exercise, a healthy diet, and of course, reducing the stress level as much as possible. So, your comments on this, please.
Yeah, the most important factor in longevity consultations is know how to understand people life and set what we can call vitality score. Vitality score to understand everything. How do you live? How to wake up? What to do? When to drink coffee? What's your craving? Everything. Toxic work, toxic relationship, everything.
It's a
So
holistic approach.
yeah, this is like
Yes.
the consultation number one. Then we'll go to what we can call metabolic code analysis, and this is my way, by the way. So I'm not.
Because each
Coping
functional
everything.
medicine dealing with longevity has its own.
But now in the coming future, everything will be standardized
Yeah.
because
Yeah.
mapping the body is the key,
Yes.
and correlated this map with your life.
Yes.
And to start.
Yes. I think there will be guidelines for later.
Because deep inside, whatever as I speak with you about your life and everything, I cannot measure how I start. So this is because deep inside, everything can mimic everything. If you have migraine, it could be hormonal migraine because of progesterone deficiency. It could be from gluten inflammation. It could be from magnesium deficiency. How should I know? Nobody. There is no clinical skills in longevity. Period. There's no clinical skills. It's skills of life and testing and to design strategies. This is very important. Longevity doctors is a specialty. Longevity is not science fiction. It's a true science. And because we have the whole technology that we measure all the precision and all the disturbances that nobody like he can live for 10 years. For example, if you test some people came for NAD for longevity, then I discover in the gut there is parasites. Who can guarantee that parasites not turned into cancer? I'm giving NAD for longevity. So it's not against NAD. It's against what's the main problem in your body. And this has happened with me, by the way. So I'm seeing, I want to start my longevity journey.
With yourself.
Yeah, for myself.
Yes, it's the best thing to do.
Hormone, peptides. We have a lot of tools. So when to start with the tools? Supplements, lifestyle, supplements, hormones, bioidentical hormone for sure. And this is a big topic, by the way. Peptides is a big topic.
Antioxidants.
Stem cells.
Yes,
Yeah,
the supplements,
including
the
the
supplements, yeah.
supplements. So ozone therapy, oxygen therapy as well. So when to start, how to start? So it's not like if you do something like if you take like 3 drips of NAD as a longevity, what's
So,
going on? You feel better for 3 months, then the problem continue.
yes.
So you want to build life.
Yes. So we
Yes.
start with testing. You are
Yes.
telling me now we have to
Starting
start
with
with
coaching
testing.
and
Yes.
then testing,
Yes.
then and after the mapping, we start design the strategy.
Design the strategies. Okay, these strategies now you tested the, you listen, you consulted the patient, you listen to his whatever history from with a holistic approach. Then you did the testing on him and the mapping, and now you are restructuring a strategy for him, or you are doing a strategy for him. So you listened to the patient's story, you tested him, you did the mapping required, and now you are restructuring a strategy for him based on a healthy lifestyle and the supplements you want to give or some procedures you want to do. A healthy lifestyle, I think it's already mentioned and people are aware about it. So I will go with you immediately to the supplement part. Yeah. What supplements you will start with and classify the supplements for longevity medicine for us?
First of all, we want to, it's a supplemented lifestyle. We can build a longevity strategy just by lifestyle and supplement. So, supplement, first of all, it could be therapeutic dose of supplement. So, it's not like if your body need 400 milligram magnesium, I cannot give 100 milligram magnesium. So, this is subtherapeutic. Should be a high quality. So, no additive, no toxins. High quality supplement is a big topic because whatever is your lifestyle is healthy, you need a supplement because you cannot trust your gut, you cannot trust the food, even if this is organic, you cannot trust the process of food nowadays.
Yes,
So you need
absorption.
high
as we said.
quality supplement, and this is a big topic. And there is, unfortunately, in the Arab world, there is no high quality supplement nowadays. Very, very, very less, let's say, very less
Yeah.
brand.
Yes.
So in longevity, you cannot go to any market and say, I want to take omega-3. No. We want to measure how much omega-3 do you want. We want to see the time. And like I want to give 3 months and take a break. They want to give. First of all, I will give something called raw materials. For example, vitamin D is raw material.
Yes.
Magnesium is raw material. Curcumin is not a raw material. So some people take curcumin for inflammation and they are not taking vitamin D for inflammation because they think vitamin D is for bone. No, vitamin D is for everything. So first of all, give your body the raw material because the system needs this. Okay?
Yes.
Need this raw material. This is how our cells has a structure.
Yeah.
And you want to give all the structure to your body. Miss glycine, for example, which is one of the most important amino acid for liver and brain and your muscle, you want to
Yes.
give this raw material to build.
If there is one raw material, you will advise the people to take it and to correct their levels.
Magnesium.
Magnesium.
Magnesium is responsible for 400 chemical reaction in your body.
Wow.
So
Not vitamin D.
yeah.
I thought it will be vitamin D.
And vitamin D is something very important. But
Yes.
now, if you want to mention something, magnesium is something very important.
Yes.
And in functional medicine, we can reverse hypertension in magnesium. So, and if this is needed.
Yes.
So, what I want to tell you, give all the herbal are not raw materials. The herbal are adaptogens. What does it mean, adaptogen? It twists the system. For example, ashwagandha, it twists the cortisol level. Curcumin, it twists the inflammation, adapt the inflammation. If you give any herbal, it adapts the pathway. So when we start to adapt the system based on the data that we have based on, okay, and try, we give the raw material and adapt it. So if I have like a car, I will give like for the engine what they need, oil and gas and all the other stuff. Then I put it at a turbo station or make it in I twist what's wrong. So adaptogens different than the raw materials.
Yes.
This is, and you want to give therapeutic dose and high quality.
Yeah.
And
So we start with the raw material based on a prescription. Please, we have to stress on this because it's not something they go and buy in the pharmacy. This is one of the messages of this podcast. This is a prescription by a functional medicine doctor who will give it to you based on your levels and based on his strategy for filling the gaps, let's say, in raw material and correcting the levels.
This is how to adjust the dosage is based on something in the other mapping. Behind that, there is 4 maps. The regular testing and the metabolic studies, the regular tests that we do with the regular labs is different than the functional testing. And this is very important because we can test the most important maps, something called hormonal mapping and something called metabolic mapping or the organic acid test, and something called gut mapping, the microbiome mapping, and inflammatory mapping, and there is epigenetic mapping and toxin mapping, and there is a lot of maps. But at least the first 4 is essential.
Yeah.
So once after studying, for example, let's say you have high CRP, high inflammation in your body. Why you have inflammation? Maybe this is related to cortisol. Maybe this is related to gut. Maybe this is related to toxins. Maybe related to whatever the reason. So maybe all of this. So I want to work on all of this. It's not like to see abnormal number. Nah, abnormal number, what to do? It's a gray zone. And in my experience, all the people came to the clinic in this gray zone without like classification the disease. Reversing disease and functional medicine is something, and longevity is different pathway. So for example, yesterday, so a patient come for longevity, and then I discovered that she has like autoimmune condition in the skin. Then I told her, okay, first of all, I want to discover why you have this before going into longevity. Because, okay, but I can give you everything and you'll feel okay, but this is wrong.
Yes, true.
This is wrong.
Dr. Wajdi, what is the NAD+?
NAD plus is something in the energy production of our body related to the key of longevity is mitochondria. And mitochondria is the energy production. We feel energetic, we feel the stamina because we have something produce energy. So this energy produced in the mitochondria to take our food and turn it into ATP is a process. In the middle of this process, there is like something called like the key of the engine is NAD. So your body, when you give NAD, you are turning on the key, but who's gonna tell you that the engine is working well? So this is why NAD is one of 10 factors for longevity and is not alone.
Yes.
I will never sell the NAD as miracle, but it is now if you work, if you put it in the wrong and the right direction, it is a miracle. So it can really, the patient can treat depression, can treat obesity, can treat everything because this is energy.
Yes.
So, but I always start with mapping, and we want to pay attention to cancer screening before NAD because it can activate cancer cell if this is existed. But if it's not existed, we're not gonna activate cancer cells. So this is very important. If you have something wrong in your body, wrong cells, and you give NAD, it's risky. But if not, this is not risky. Maybe it can prevent.
Yes.
It can prevent, NAD can prevent from cancer by working on the DNA structure. So you want to pay attention about all of that.
There's a lot in there, but one last question for the sake of time, but I promise our viewers and the listeners to do another podcast with you or maybe more. You prefer the NAD plus as IV drips or supplements? Because this question many people are asking.
Yeah. In Dubai, there is a lot of NAD, but there is no testing. Now there's a lot of companies, I'm working with a lot of companies, they are working to test NAD. If your NAD is low, okay, because there is, preferably to start with IV. Because I boost the body for 2-3 times and we increase the dose gradually. There is a protocol for that. Then I will go into an R or an MN. Between an R and an MN, I think the same results would not to go into this discussion. And you want to take it for 3 months continuously, then you can take a break.
Yes.
But take a break 2 to 3 months, then resume. This is a cycle of NAD production. So the most important part, if you don't want to go into IV, because giving an AD and your NAD is not low, sometimes you can feel some side effects, especially if the infusion is high risk, high rate. So you want to give it in slow infusion. You feel like palpitation, dyspnea, nausea, crampy abdominal pain. Some people afraid about of the symptom. It's very simple and very transitory, and then everything will go in the right direction. But you want to understand, it's not something like
Magic.
it's not something like mandatory. You can go to tablets and commit for 3 months, and this is will gonna get the same result.
Yes.
But it's a slow effect.
Yes. So, Dr. Wajdi Albonji, thank you for being with us in this podcast. Definitely, we'll have more podcasts to speak on longevity because it requires a lot of information and there's a lot in there. But I will leave you to speak to our listeners your final thoughts or your takeaways.
Yeah.
What will be the takeaway?
I want to
this
say,
podcast?
like, research showed our longevity is 20% related to genetics and 80% related to our life. So your age is in your hand and definitely God. So, but we have a big responsibility. And the future of medicine is brilliant. So there is a study showed, if in the next 10 years if we live right in the next 10 years, there's a high probability to live longer and healthier. And now is the time. And Dubai is the city. And we are ready to change our mindset first. If you don't have a life goals, if you are not like aggressive to change your life, don't go and spend money right and left for some people say for you, take this and take that. This is not a longevity. This is a trial. Just like you're gonna eat chocolate to try, you can try it. It's not like this.
Dr. Wajdi Albonji, thank you very much.
Thank you. Thank you.